Okay, starting now. What's up? Okay, I will start from the beginning because, yeah, okay?
Now you put your hand in front of the phone.
Yeah.
Yeah, keep it in that square.
Here? Yeah, I know, this one, right?
A bit here, a bit
here.
Here. Yeah.
Okay, so I'll bring it this one here. Okay. Okay, so once we want to start with the instruments that we need for the oral surgery, okay. First we need the tray where include the diagnostic instruments. So first we have the tweezer, we have the probe, close the door, mirror, diagnostic mirror, then we have the periotome. This one we can use it for deattach the gum or periodontal ligaments. But for any procedure, it is very important that I need to have my diagnostic instruments, okay? Diagnostic instrument is important for any kind of treatment in dentistry. If it's restorative, if it's filling, if it's extraction, because I need to check intraorally. So this sets, it have to be included in whatever treatment you are providing to the patients, okay? So once we settle with this part, okay. Next, I need to move to injection. Before we are providing any treatment for the patients, especially for the oral surgery, we need these two sets, one of these two sets of syringe. So the difference between this one, this is the aspirating syringe, this is the non-aspirating syringe. I have two figures that I can identify aspirating from non-aspirating. First is the ring here, the thumb ring, where can I engage with my thumb to aspirate before injecting inside the patient mouth. This one it doesn't have. Okay, this is the first figure. The second figure, when you can see clearly, this one got the harpoon, okay, and this one doesn't have the harpoon. The harpoon advantage is to engage inside the cartridge rubber, this part. So I engage it inside, whereby it helps to aspirate and to check if there is blood drop here before injecting. So it's make sure that I'm avoiding any arteries or blood vessels, okay? So that's the advantage of the harpoon and the thumb ring, okay? While the non-aspirating, it doesn't have it, okay? Second part, we have it for the syringe, for injection set, is the cartridge, okay? Cartridge, it comes usually in different colors. So when you're looking here, you can see one is green, one is red. And as we mentioned before, each color, it's considered a color code. So each one is identifying something. So when I'm talking about the red cartridge, this is like LA with adrenaline. The green cartridge is LA without adrenaline. So I need to identify, is the patient healthy? Then I go with adrenaline. Patient non-healthy, then I have to go with non-adrenaline cartridge. Because the patient is under, you can mute, yeah. Guys, for those who came late, you can mute your mic. I can see 7 or 8 of you unmute, so you just mute it. If you want to ask question, unmute it, then you ask me anytime. But whenever you are not interesting to us, don't, yes. Switch off the camera also.
Try to keep your hand a bit closer. Okay.
Sure. Who else unmute? Okay. Okay, so we continue again. So I have to understand, is the patient healthy or the patient have cardiovascular problem? Patient have cardiovascular problem, then I better go with non-adrenaline cartridge. Okay, if the patient healthy, then I go with adrenaline cartridge. That's why how you differentiate between, whose phone is this? You just ask them to get out from the clinic, whoever is there. It's disturbing.
Get out.
Okay, second part is the needle. So I have the short needle and the long needle. Okay, also it depends, we need to identify which technique we are giving. Okay, so as we mentioned before, all kind of injection intraorally, we are going with a short needle. Okay, except inferior alveolar block, whereby I need to penetrate more than 25 mm, then I need to go for the long needle. So it's very easy. You are planning to do extraction. Which tooth you are doing the extraction? Okay, so I identify this tooth need to be extracted. I definitely need the inferior alveolar block, as I am having like extraction of lower molars, right? But if let's say I'm giving any other injection, any other place, then I need to go with the short needle. That's why always when you're having like surgery or you're doing extraction, you need to identify first patient condition. Then you go with the adrenaline or non-adrenaline. Then what is my treatment plan? I'm doing flaps, I'm doing extraction. What is the location I'm doing? Let's say I'm doing extraction for the lower first, second, third molar. I need to go with the long needle. I'm doing extraction for any other places, then I need to go with the short needle. Clear? Okay. Any question? If you want a question, you can unmute, then ask me. No question. Okay. Okay, so this part first finished. As we mentioned, we need the diagnostic set, which is like must for all kind of treatments. Then secondly, we are having the syringe sets, the cartridge sets, then the needle sets. Okay, so that's clear. After injection, before doing extraction, I need to use the periostal elevator, whereby I use the short and thin tips. I need to deattach the gum or periodontal ligament. Okay, you can use the probe if it's like difficult, like for most posterior, like second molar or last third molar, sometimes difficult to use it. Then I can use the probe just to use the probe to engage inside the periodontal ligament, then you deattach the gum. Okay, but this one, when you are talking about extraction, this is very important to deattach the gum or the periodontal ligaments from the tooth. I don't want to do extraction where is the tooth attached to the gum. Later it will cause tearing to the gum. Okay, so that's part done. Second part, I'm talking about extraction. For instrument of extraction, we have different sets. Like we have these, what we call it elevators, then we have the forceps. Okay. Just let me get the instrument here. Okay, so all these we call it elevators because we are having two sets of instruments for extraction. These elevators and these the forceps. This is the main two instruments we are using. Ideally, when you are going for extraction, you need to deattach the gum and periodontal ligaments. Then it's better if I'm using the elevators to make the tooth loosen inside the sockets. Then I can end up with the forceps. Then to extract the tooth. Sometimes I can do it with the extraction only with the elevators, also can. Sometimes I might not use the elevators because I go directly to the forceps. All technique is correct. The most important, you need to lift the tooth from the socket without damage to the soft tissue or to hard tissue. That's my idea. I need to do a traumatic extraction. But sometimes even like some teeth, some kind of teeth, I cannot do with the forceps. When I'm having root stump, which is subcrystalline, that the tooth level, the highest level of the tooth or the roots is already caries or broken and resolved until become below the level of the bone. So definitely I cannot have engagement with forceps because these forceps have to engage on the tooth. Okay, so if I cannot have engagement, definitely this is my option for extraction. I cannot do extraction with the forceps, so I need to do with elevators. So when you look here, we are actually having different sets of elevators. This is the first one, we call it Copeland, and Copeland comes in 3 sets. Like it's come as Copeland number 1, number 2, number 3. And these numbers is based on the thickness of the blades. So you see the first one is like very thin, we call it number 1, then moderate, which is number 2, then the wide one, which is number 3. Okay, so this one actually I better start with number 1, especially when I don't have space between the tooth and the bone, because I need to engage this instrument between tooth and bone. Second, if I created space with this, it's become loose, then I need to go with number 2. This become loose, I need to go for number 3. Okay, so once we are engaging this instruments, I engage between the tooth and the bone. So it should come here. It should not come between the 2 teeth. It should not support on the teeth. It should support on the tooth and the bone. Okay, so once I like zait, it become loose. I cannot use it anymore. It's not a fault of the technique. Sometimes it's become loose, not it's because you don't know how to use it, but because you already created space between the bone and the tooth. So after that, you need to go for bigger one, which is number 2. Engage between the tooth and the bone. engage until you laxate. Once you laxate, become loose, then you go for number 3. So sometimes you can do the extraction with number 3. Sometimes it's become loose also, but the tooth not extracted. That time when I use the forceps, because already I created space to make the tooth loose where I can engage and lift with forceps. Okay? Any question up to here? Any question from you guys? It's good if you ask also. Okay.
Ask after the video.
No, you can ask also, no problem. Can, don't worry. Okay. So this one clear? Okay. So this sets, we call it like the coplane. All this comes as under elevators, but these 3, we call it coplane. Okay. So coplane 1, 2, 3. Okay. Second set I have, we call it the Warwick-James. Warwick-James, we have 3 sets of them. Okay. Right, left, and straight. Okay. This one actually we can only engage mesially, buccally mesially on the tooth. So you need to identify. Okay. This is the jaw here. You can see this one. You can see this one got the surgical curve. You see, surgical curve. Okay, so this surgical curve, operating curve, should always approach mesially. Give me the upper one. Okay, let's say I am having this one. So if I want to apply this one mesially buccally, this one cannot, because the curve is toward me. The curve should be toward the tooth. So this one I can use it for the right side, which we mean the right side of the patients, not your right side. Okay, so you see this one I can use it only on the right side. Okay, you cannot use it on the left side, because if you are using this instrument on the left side, the operating surface of the surgical surface, it will become toward me, which is distally to the tooth. I cannot use it, because this one we use it just to push the tooth backward, so it will help the tooth to come out from the sockets. So when you look at this one you identify it as the right side, this one left side. Okay, clear? Is this clear on the...
No, it's very far.
Sorry? Wait, I'm trying to... Okay. It is not focusing. Wait, I need my help to focus. Oh, okay. Okay, you help me. Okay, so when you look, this one got curve, right? Always you need to maintain this curve on the mesial surface of the tooth. So you see, at the back is like concave, here is convex. Okay, I think it's not very clear, right?
Too bad we got the video. Next.
Yeah. You will see this one is like the curved surface outside, and this is the convex surface, right? So this surface have to go on the mesial surface of the tooth, should engage here. Okay? Can you see the curvature or no? Okay. So this curve have to go on the mesial surface of the tooth. Okay. So when I see the curve, always the curve have to be away from me. Okay, so when I look at this instrument, once this curve is toward me, I'm holding in this way. Okay, when you are holding in this way, I think, yeah. This is technical issue. Okay, so you see the curve. Do you notice it now? You see the curve? Wait, not clear.
When you come to clinic, you will see.
When you come to clinic, yes, you will see. Okay?
Just know that
So always like you have to maintain. I think if you compare this one to each other, you will understand even more. You see, one surface is convex, one surface is concave, right?
Take a picture and send to the group.
Okay, you take and okay, but always make sure this surface, the working surface, have to go mesially. So I can use it here on this side, but I cannot use it on the other sides. Okay, your colleague will take photo and send to the groups. Okay, same times we are having this one, we call it straight, because you see this one is not right, is not left, is only straight. Okay, so this one I can use it for both right and side, while the other two instruments, either you use it right or you use it left. You cannot use it on both sides. Okay. Okay. So when we use this one, this is actually we use it to extract mostly the last tooth, the third molar. Or let's say if we don't have the third molar, we have the second molar, then we can use it for extracting the third molar. But make sure there is no tooth distal to it. Because this one, once you are engaging here, once like you are rotating the instrument, so it will push the tooth downward, backwards. So I don't need to have any tooth distal to it because it will block it. So you imagine if I place it here and I'm trying to rotate, the tooth trying to go down, then distally. This 8 will block this one. So it's better, we advisable use it on a tooth that doesn't have the tooth next to it, distal to it. We use it mostly for the upper 8 because this one, when you are applying force on the tooth, it will reduce the force on that tooth. So actually it will minimize the damage of tuberosity. We have tuberosity here, which is easy to get broken. That's why when we talk later about crier, you see crier is like bigger size and it can apply more force on the 8. It's easy to break the tuberosity. So when you're talking about upper 8, we extract with Warwick James, not with the crier. Okay, so we don't use the crier, this one. When we're extracting the upper 8, we use the Warwick James. Okay, clear? Because this one actually it will reduce the force on the tooth. So it's very hard to break the tuberosity, but easy for removing the tooth. If you are using the crier, it's very easy to break tuberosity. So it better avoid. Okay?
Doctor,
Yes.
this use wheel and axle kind of
Sorry?
What's the motion of action?
Yeah, this is like like rotating only. Okay, this one, all these elevators, you should like imaginary line the axis here. Okay, so once you are stable in a position, once you are stable here, right? This instrument have to go in rotating movements. You cannot lift it up or down. It's not lifting or levating movements. This is only like you rotate around the axis, just like screwdriver. You screwdriver, when you unscrew, you just rotate, right? You don't push up or down. Okay, so this one always you need to consider the axis here. Okay, the axis should be here, then all your movement should be rotating only, not lifting up or down. That's it. Okay, that's why, because I need first to support on the bone. Once I'm supported, then I just rotate. Okay, clear? Sorry?
what instrument is that?
This is Warwick James. Okay? Okay. You differentiate Warwick James from crier. You see the tip, I think is very clear. Warwick James, this one, the tip is very small. This is the crier, where the tip is very big and triangular with pointed tips here. Okay, so we move next to the crier. The crier also, you can see there is two parts. Okay, but this one is not right and left. I can use this one on the right and left side. I can use this one on the right and left side. Okay, because this one, it depends on which location you are using. Okay, this is mostly used when you are extracting the molars, like molars have two roots, right? So imagine after extracting the 3-7, one root extracted, which is distally, mesial one still broken inside the socket. So what you can do, you can engage the instrument inside the socket, press on the roots, then take it out. Because this one, it will help me to break the interseptal bone here in the middle. So I can use this one on the 3-7, inserted inside the sockets of the distal roots. Press on the sockets, then lift it up. Okay, let's say opposite happen. Mesial root extracted, distal root broken. So what do? You insert this instrument inside the socket, press on the interseptal bone, you break it, then you engage with the roots, take it out. So I can use right, left, I can use both on the right side or the left side based on which location I'm using. Okay, sometimes what's happened, you are trying to extract the 7, but it's difficult to engage with the forceps. So what we should do, with the handpiece, we drill one hole here, just above the gum. We drill here, okay? So once I created hole here, I can engage buccally, I place the tips of the crier inside, then I support on the bone, then I can lift the tooth up. So the tooth will be extracted. The other application, when I'm extracting the wisdom tooth, whereby I remove one root, then I can engage also inside the socket, then remove the other tooth. So I use it when I need too much force, and I make sure there is bone supporting. That's very important.